Hello everyone, my name is Vishal Kumar, and today I will be presenting a project that my team, Dr. Georgiana Sedler, Dr. Noah Gubner, and Dr. Sarah Walker and I have been working on. Improving implementation of evidence-based practices through case-based consultation to supervisors. Evidence-based practices. What are they? EBPs are the integration of the best available research with clinical expertise in the context of patient characteristics, culture, and preferences. Why is this important? EBP allows patients to receive treatment that is clinically proven to help one's mental and emotional health. Despite research supporting the efficacy of certain mental health practices, many mental health care providers and community mental health institutions are not utilizing evidence-based practices consistently as their method towards patients receiving mental health care. This is a problem because the patients that are in need do not benefit from therapies intended to help them. What is stopping EBP implementation? Clinical supervisors are supervisors that provide clinical direction and guidance to less experienced providers. They play a significant role in how often and how effective clinicians are at implementing EBPs in their treatments. As Dr. Gray states, inadequate supervision is a barrier to the implementation of EBPs. In addition to that, Dr. Bierman states one way to overcome this barrier. Specific supervision practices are shown to be increasingly effective in implementing EBPs. An example of this could be role-playing and modeling. What is the purpose of this study? The purpose of our project is to examine the feasibility and self-reported usefulness of providing case-based consultation to clinical supervisors in supporting the implementation of EBP. While doing this, we will be adding literature of clinical supervisor support, specifically for CBT plus supervision competency, and gain a better understanding of factors that may impact supervision competency. Our short-term goal is to improve competency of supervisors who oversee therapists providing EBPs. Our long-term goal is to increase effective use of EBPs in clinical practice. What is CBT plus? Cognitive behavioral therapy is a form of psychological treatment that has been demonstrated to be effective for a range of problems. CBT plus focuses on using CBT to treat 4 specific areas: depression, anxiety, trauma, and behavioral problems. Anxiety and trauma. This consists of emotional regulation, exposure, and cognitive processing. Depression consists of emotional regulation, behavioral activation, problem solving, and cognitive processing. And finally, behavioral, which consists of parent management training strategies. Methods. We sent out a pre-survey via email to 10 clinical supervisors. This self-report survey was analyzed on Qualtrics, and it measures supervisors' demographics, supervision competence, organizational climate, and CBT plus supervision competence. We ended up with 8 responses, and the results were exported to Excel to be summarized. In addition to the pre-surveys, 6 monthly conference calls with an expert, consultant, and clinical supervisors were conducted. These consisted of 15-minute mini-didactic on how case-based supervision related topics, and the following 45 minutes were spent on case-based consultation of real supervisor scenarios. Finally, post-surveys were sent out after the conference calls. In this slide, Table 1 shows the demographics and clinical characteristics of clinical supervisors. In the first 4 rows, we see that the majority of clinical supervisors in this study are age 40 or above, female, identify as white, non-Hispanic, and that all supervisors had a master's level degree. The 6th row shows the supervision practices. We can quickly tell that these supervisors supervise on average 7 clinicians and discuss an average of 3.13 cases per each supervision session. And finally, in the last row, it is clear that on average, EBP is a priority for many agencies that these supervisors work for. In this slide, we'll discuss Table 2, which shows the self-reported general competence of this supervision. Supervisors reported answers on a Likert scale, with 1 being minimal and 3 being advanced. The first 2 columns show the results of the survey, both pre and post-training. The third column shows the change that occurred between pre and post-training. The first 2 rows show how supervisors feel better equipped to engage with not only caregivers that were reluctant of EBP treatment, but also children who were reluctant. Rows 6 through 9 speak to the increased level of competence for EBP supervision. I would like to highlight line 7, which shows the large jump of competence that supervisors felt in helping their clinicians stay focused on EBP after the training that they received. In this slide, we'll discuss the supervisor competence for CBT Plus in depression-focused treatment in Table 3 and the supervisor competence for CBT Plus in anxiety-focused treatment in Table 4. Supervisors reported answers on a Likert scale, with 1 being minimal and 3 being advanced. It is important to note that the first 3 rows of both tables illustrate the large improvement that supervisors had in terms of competence for using assessment measures, psychoeducation, and cognitive triangle. In this slide, we'll discuss the supervisor competence for CBT Plus in behavioral problem-focused treatment in Table 5, and the supervisor competence for CBT Plus in trauma and PTSD-focused treatment in Table 6. Supervisors reported answers on a Likert scale, with 1 being minimal and 3 being advanced. In Table 5, we see how the training really helped the competence of supervisors for behavioral problem-focused treatment, as nearly all the categories had a delta of above 0.50. In Table 6, we see a similar trend and a giant increase of 0.75 in both the trauma narrative and in vivo exposure. In this final slide about data, we lay out the post-training evaluation of satisfaction and effectiveness for clinical supervisors in this study. Supervisors reported answers on a Likert scale, with 1 being very dissatisfied and 5 being very satisfied. Every row had a rating above 4.5, and some rows had a nearly 5.0 rating, which shows lots of satisfaction and an overwhelming amount of effectiveness in the eyes of the supervisors. This shows that the supervisors were generally very pleased with the training that they received and that their effectiveness as supervisors was extremely satisfactory. From this data that we have gathered, we confidently believe that overall this study showed that these 1-hour consultation calls that supervisors went through, which consisted of 15-minute mini didactics on case-based supervision related topics, and 45 minutes of case-based consultation for real scenarios that supervisors faced while implementing EBP, overall increased the self-reported competence of supervisors supervising clinicians as they implement EBPs in their practice, along with the training being satisfactory to the participants. This suggests supervisor consultation training provides a potentially useful model of improving CBT in clinical practices. What is next? The next steps will be for us to finish transcribing and analyzing consultation calls that occurred. In terms of further research, we hope that this pilot study will not only add to the literature of clinical supervisor support, but equally as importantly, be the inspiration for a larger study to occur that implements similar, if not the same method that was used in this study. Thank you so much for attending.